Hello guys, hope you are well. This is Dr. Iqbal. So a lot of you guys were asking me to record a session on prescription writing for PLAB 2, and I've been receiving a lot of messages that candidates have been having a real trouble with prescription writing. So I decided to record a session on prescription writing to make it easier for you guys so that you're able to solve the prescription writing station for PLAB 2 exam and you're able to score maximum marks in this station, right? So before we begin, I'm sure a lot of you guys would have used the Medscape app, which is basically an American version of PNF. Just like in the Medscape app, you search for the drug and then you look for the condition which your patient is having and then you adjust the dose accordingly. Similarly, here you are also going to look for the drug's name in the PNF, which is British National Formulary. Don't worry, the book will be present inside the cubicle, and you have to look in the index for the name of the drug, and then you have to go to the relevant page. Then you have to adjust the dose accordingly. That is the main issue which the students were having. Right, so before we begin, there are a few things which I would like to tell you guys so that you are able to score maximum marks in prescription writing station. First thing is that the task is going to be obviously written outside the station. So read the task carefully. As soon as you enter the station, there's going to be a table and there are going to be a few things placed on the table. So I'll let you know what those things will be. First of all, there will be some pens, right? There'll be black and blue pens. Make sure that you pick up the black pen. Don't pick up the blue pen and don't fill in the data by blue pen, because if you fill in the whole prescription writing station using the blue pen, you guys will lose marks. So make sure that you pick up the black pen. Second thing is that you have to fill in using the block letters. For example, if you are using this, if you have to write N, this is a block letter, whereas this is a small letter. So you have to make sure that you write everything in the prescription writing station in block letters, right? Next thing is that you have to write in the block letters, and next thing is if you have to write like abbreviations. For example, if you have to write mg, milligrams, you guys can write mg like this, small m and then small g, right? You guys can like milligram just like this. And if you have to write grams, you can write g to represent grams. You can write like this. But if you have to write micrograms, you are never going to write micrograms like this. The symbol for micro, you're not going to write micrograms like this, but you are going to write the full form, micro, M-I-C-R-O, right? So you are going to write the full form for micrograms, right? So these were a few details about how you're going to fill in everything in the prescription writing station, right? So next thing, let's move on, and I'll tell you guys as to how you're going to fill in the prescription writing, right? So this is what the page is going to look like. What you're going to do is you're going to fill in all of the patient details here. The ward number will be provided to you. You have to fill it here, the hospital number, the consultant's name, date of admission, weight, height, everything you have to fill it here. All of this information will be provided to you guys on the questionnaire, so you just have to copy paste it. You just have to copy from the questionnaire and paste it here in your own handwriting, right? On here on the right hand side, you have to fill in all of the information. But sometimes what they do is they provide you stickers inside the room, stickers looking similar to this information. All of this information would be provided on those stickers, so you just have to peel those stickers and paste them here on the right hand side, right? And as soon as you're done filling in these details, a lot of candidates are tempted to just jump right into the prescription writing to find the dose of the drug. before that, make sure you fill in all of the patient details. Then you move on towards the finding the dosage of the drug, towards opening the BNF, right? And make sure you fill in all of the data which you have been already provided, because if you don't fill in the data you've already been provided, and you start looking up the BNF, it has happened with a lot of candidates that they waste time looking up in the BNF, and then when they come back towards writing on the prescription writing, they don't have any time left. So make sure you fill in all of the details which you have been provided beforehand to secure your marks as much as you can. Then move towards opening the BNF. I'll explain it to you guys how you're going to do this in a minute, right? So next thing is allergy. If the patient is allergic to anything, for example, amoxicillin, penicillin, any drug which the patient is allergic to, you are going to fill it here. Next thing, the type of reaction, for example, itching, rash, anything the patient has, you'll write the type of reaction here. And then again, your name, signature, and date, you'll write them in the respective columns, right? So next thing is for once only medication. For example, if you have to give your patient any single shot of any particular drug, you're going to write in once only prescription. For example, if you have to give your patient IV hydrocortisone, a single shot of IV hydrocortisone, you're just going to write it here. Date required, the date, it is obviously going to be the date of your exam. The time required, the dosage of the drug, the drug's name, and the route and the dose, right? And then your prescriber signature and your PLAB number. You guys will be provided your PLAB number, right? So you just have to fill in the details. The next boxes you can leave them empty, or the person who is going to administer the drug to the patient is going to fill in these details. Next thing is oxygen. A station hasn't come so far on oxygen, but I'll explain it to you guys how you're going to fill this. The date and month, you're going to fill it here. For example, if you're having exam in March, you'll write 6 March, for example, you'll write 6/3, 6/3, just like this. So that is how you're going to write the date, 6/3, right? So similarly, if you're So similarly, if you have to, then you're going to take what the target saturation of the patient you want to be. For example, if you want it from 94 to 98%, you'll just take it here. If you want it between 88 to 92%, you'll just take this one. If it is a COPD patient and you want the saturation to be between 88 to 92%, just take this section. Then the way you're going to administer the oxygen through a Venturi mask or simple face mask, whatever it is, you'll write it here down below. I'll just show it to you guys in a minute, that how you're going to fill these details, right? And then the duration, if you want to give oxygen in the morning or in the evening, or if you want to give it 24 hours for 24 hours, you'll tick all of these 4 boxes, right? So let's move on. Right, the next section is for antibiotics. How you're going to fill this? You're just going to write the drug's name here, the dosage of the drug which you want to give, the route through which you want to give, whether it is oral, PO, or IV, right? The start date, the stop date, then your signature, and make sure that you use your last name. For example, if your name is John Smith, do not write here Dr. John, but instead write here Dr. Smith, right? The GMC number obviously is going to be a GMC number. Bleep number, it will be provided to you in the exam, so you just have to write it here. Indication for what purpose you are giving this antibiotic, and any additional information that you want to give, you can put it here. I'll explain it to you guys how you're going to fill in everything just in a minute, right? Then the regular medication. Again, before jumping right into writing the regular medication, look here. You have to fill in all of the patient details again, peel off another sticker and paste it right here, right? So after you're done filling in the details, then you can move on. Then you have to fill in all of the patient details, the drug, the dose, the prescriber signature. After filling in these details, then write the date and month over here. Here you're going to write the date and month. Obviously the start date is going to be your exam date. Then whether you want to give it in the morning, midday, evening, bedtime, so you just tick the relevant box. That's how you're going to fill this page. Similarly, as required or PRN medication, especially in the case of palliative care, you're going to fill it, just fill in all of the boxes just like we've been doing before. The drug, the dose, route, frequency, everything you'll just fill it in here. Um, Next thing, the anticoagulant treatment. Again, before moving right into the anticoagulant treatment, you will first fill in the patient details. Obviously, this form is going to be, this page is going to be used for warfarin only. For dalteparin and oxaparin, for all those types of anticoagulants, you're going to fill them here in the regular medication chart. But if you are prescribing the patient warfarin, then you have to fill this form, and then you have to write the target INR as well, the dosage, or then the prescriber signature, the bleep number. A station hasn't come on warfarin so far, but you guys should be prepared for it. You should search in the BNF the dosage for the warfarin and everything, and you should be prepared for it as well, right? So yeah. Sorry, here are the examples I was talking about. You are going to fill in the patient details and your biodata here. Then this detail, usually a sticker is provided, so just peel off a sticker and paste it here in the right hand side of the box of the page, and just move on. Do not bother about or waste time filling in all of these details manually, right? So next thing, in the regular medication, you have to write the date and the month over here, just like this. Then the dosage of the drug which you have found out from the BNF or you have been provided, you are going to write it here. The dose, the route, for example subcutaneous, then the date which you're going to start, and then your signature. And what time do you want to give it? In the morning, in the evening, bedtime, midday, whatever it is. And if you want to exclude any particular days in between, so just cross the boxes just like this, right? So the person who is going to administer the drug, they would automatically know that they have to omit these days, right? So rest of the examples here are right in front of you. You guys can pause the video here and have a look at them, right? So if you're going to stop any drug, for example, if the patient is having statins and you're going to prescribe them clarithromycin, we already know that clarithromycin and statins are not given together because they cause rhabdomyolysis. So just cross out a particular drug, just cross it out like this, right? And write your name and signatures here down below, so that it is clear that which doctor crossed this out. And then you can write a reason as well. For example, if you're giving statin and clarithromycin, you have to review the medication, you can just write hold for review, right? Just write hold for review next to your signatures, right? So here's an example of clarithromycin. If you have to give in clarithromycin, you can see that this data has been filled in block letters, so that's how you're going to do it. Then 500 mg PO, we already know the dosage of clarithromycin. For adult, that is 500 mg PO BD. It is given in BD, so you are going to write the time here, 0800, which means at 8 a.m. in the morning, 2000, which means at 8 p.m. at night, and the date is going to come over here. Then the indication is lower respiratory tract infection, so you guys can write LRTI, or if there is any other indication, that is how you're going to do it. Similarly, the first page of the prescription writing, this is how it is going to look like. You have to fill in all of the details as I've already mentioned before. For oxygen, you have to write the nasal cannula or the venturi mask over here, right? So you guys can pause the video here and have a look at have a look at this page as to how you're going to fill in the details in the prescription writing station. Alright, so those were the basics till here. Let's jump right into the stations and practice a few stations, and I'll show it to you guys how you're going to fill in the details, how you're going to find the dosage of a particular drug from the BNF. just know that guys, you guys won't be comfortable with prescription writing unless and until you hold the BNF in your hands, you practice the stations manually, and you learn how to use the BNF. You learn how to use the BNF. Unless and until you don't do that, you guys won't be comfortable with prescription writing station. So what I recommend to all of my students is that put all of the stations which have already come in the past, put them in front of you, put a BNF in front of you, take a pencil and a prescription writing paper, right, and practice all of the stations manually. Set a timer for 8 minutes or 7 minutes, right, and practice all of the stations manually all by yourself. That way you would know how to solve a station, how to look for a drug's name in the BNF, and then you would be able to master this prescription writing station, right? So yeah, here we have Mr. Rio Fernandez, age 50 year, who has been admitted due to cellulitis. So the information which we have been provided, we know that the patient's age is 50 and the patient has cellulitis, diabetic foot. The patient is having an infection. Patient has been diagnosed with diabetes. All right, he's on metformin 500 mg TDS. A very important information. Very important information, right? Um, Next thing, consultant has requested you to start her on cotrimoxazole with gentamicin or metronidazole. All right. So the information which we have already been provided, that is obviously the patient data. You are going to fill in all of that first. Then metformin 500 mg TDS. This is going to come under regular medication. Fill in this detail first. Secure your marks for this information which you have been provided. Then move towards opening the BNF. Fill in under regular medication. Fill in tablet metformin 500 mg PO TDS 3 times a day. Secure your marks for metformin. Then move towards prescribing the patient cotrimoxazole or metronidazole, right? Cotrimoxazole or metronidazole. Let us, and another thing, patient is allergic to penicillin and has itching. Fill in this information as well in the allergy section, right? So let us jump, have a look at some BNF images, how you're going to look for the drugstore. This is what the BNF page is going to look like. We have opened the page name for cotrimoxazole, and our patient was having a susceptible infection, moderate diabetic foot infection, severe diabetic foot infection. Alright, so this is what our patient is having. And the dosage for cotrimoxazole for adult is, obviously our patient is adult, 960 mg twice daily. This is the dose which we are going to give to our patient by mouth, PO. It is going to be PO BD twice daily, 960 mg, right? So the next drug which was recommended was either gentamicin or metronidazole. So a lot of candidates have asked me that cotrimoxazole and gentamicin are both nephrotoxic. Can we prescribe them together? The current version of PNF, which is here, I looked in the whole directory and in the whole formulary, and I could not find any interaction of cotrimoxazole with gentamicin. So up till now, it was we can prescribe cotrimoxazole and gentamicin together. But if any updated version of PNF comes, or any updates come, or anything changes, then we might not be able to prescribe these two drugs together. Then we might have to prescribe cotrimoxazole along with metronidazole. But we will have to check the latest BNF, the latest guidelines for this, right? So the next thing, obviously we are aware of the dosage for metronidazole. All of us know that it is 400 mg TDS for adults. Let us look for the gentamicin stores. Alright, so here is the condition which our patient is having: moderate diabetic foot infection, severe diabetic foot infection. So the dosage is initially 5 to 7 mg per kg once daily. This is going to be the dose. We are simply going to multiply this by the weight of the patient, and we would have the dose which we are going to give to our patient, right? And obviously it is going to be an intravenous infusion, so we are right, the route is going to be IV, right? Alright, so here's the key: cotrimoxazole by mouth 960 mg twice daily, and gentamicin 5 to 7 mg per kg once daily by intravenous infusion. For metronidazole, 400 mg every 8 hours, which means TDS, right? So this is how you're going to find the dosage of drugs and fill the details in the prescription writing paper. All right, let's move on to another station. Peritonsillar abscess. What the GMC they do is they trick the students by changing the condition, by changing the antibiotics, and by changing the disease, and all of the students they get confused as to what they have to do. So be prepared, be prepared. Any station can come. They are just going to change the condition and they're going to change the drug's name. You just have to. The examiners they just want to know whether you can use the BNF or not. So you just have to be prepared for it, and you should know how to use the BNF, right? No matter what the condition is, no matter what the drug is, you should be able to look it up in the BNF, right? So here we have Miss Tracy Yates, age 6 years. It is a child that we have now, right? Has been diagnosed with peritonsillar abscess, Quincy. There are no signs of dehydration. Weight of the child is 23 kg, right? Consultant is advised to give the following medication: phenoxymethylpenicillin, metronidazole, IV fluids. Write down the prescription, check doses with BNF, calculate the fluid dose. We have to calculate the fluid dose as well, right? Patient is allergic to clarithromycin, patient has itching, right? So before moving in, we haven't been provided details of any drug, we haven't been given dosage of any drug, we have to look it up in the BNF. You are going to fill in all of the patient details first. You are going to fill in the information regarding their allergies. Then let's jump into the BNF and solve this station. You're going to search for phenoxymethylpenicillin in the index. Index is provided at the end of the BNF. You're going to look up this name, and then you're going to search for the page, which is 581. Here it is written, right? So phenoxymethylpenicillin. Oral infection, otitis media, acute sore throat. Quincy is a type of acute sore throat, so we are going to give the child this dose. The child's age was 6 years. We are going to choose this dose, 250 mg 4 times a day, or we can give 500 mg twice daily for 5 to 10 days. Similarly, if we look up here in oral infection, obviously Quincy is a type of oral infection as well. The dosage is same, 250 mg 4 times a day, which means QID, 250 mg QID, right? By mouth. We have to give our child 250 mg 4 times a day PO. That is going to be the drug, the dosage which we are going to prescribe to the patient, right? So we have been able to find the dose of phenoxymethylpenicillin. Let's move on to the next one, metronidazole, right? So what is the condition which our patient is having? Is the patient having an anaerobic infection? No, right? Moderate diabetic? No, the patient is not having any diabetic foot, neither cellitis nor Crohn's disease. Okay. Diverticulitis? No. Pressure sores? No. Bacterial vagina? We have to search for the condition which our patient is having. Acute oral infection. Here we go, right? So Quincy is a type of acute oral infection. Our child's age was 6 years. So the dose for our child for metronidazole is going to be 100 mg every 12 hours for 3 to 7 days, right? So the dosage is going to be 100 mg BD PO for 3 to 7 days. We can give for 5 days, right? It lies between in between the range, right? So we can give it for 5 days. Yeah, so here comes the fluids formula. I'm sure all of you guys are aware of how to calculate the fluids. For first 10 kg it is going to be 100 ml per kg. Then for the next for the weight between 10 to 20 kg it is going to be 50 ml per kg, and any kg beyond 20 kg is going to be 20 ml. So our child's weight was 23 kg. We will calculate the child's 24-hour fluid requirement using this formula. So let's do it. I'll tell you guys what how much fluids are going to be you guys won't be provided any calculator in the exam, right? Keep this in mind. So learn how to do basic mathematics. You should be able to do simple multiplication and division. That you obviously you will be provided a piece of paper in the exam, so you can do these mathematics there. So our child's weight is 23 kg. For first 10 kg it is going to be 1000 ml. For next 10 kg 50 ml per kg, that is going to be 500 ml, so it comes to 1500 ml. So we still have 3 kg left, which are beyond 20 kg. That is going to be 20 into 3, 60. So the total requirement for our child is going to be 1560 ml for 24 hours, right? So if we divide them by 24, it comes to 65 ml per hour. 65 ml per hour, that is going to be the fluid requirement for our child, right? So here is another formula provided. If it is an adult patient, the weight of the patient is 50, 60 or 70 kg. This formula is simple: 4 2 1. 4 for first 4 ml per kg per hour for first 10 kg, 2 ml for the next 10 kg, and anything beyond 20 kg is going to be 1 ml per kg per hour, right? So here's the key which we guys looked up for in the PNF. For child 3 to 6 years, 100 mg every 12 hour. PD for 3 to 7 days, phenoxymethylpenicillin 250 mg 4 times a day. QID, this is the dosage which we looked for in the BNF. So the scenarios are really simple. They're not difficult at all. You just have to know how to use the BNF. If you're able to do that, the prescription writing is going to be a piece of cake for you guys, right? So here we have a case of non-valvular atrial fibrillation. You are an FY2 in medicine. Mrs. Andrea Brighton, aged 81, was diagnosed with non-valvular atrial fibrillation. Patient had cabbage 10 years ago, right? We have some past medical history. EGFR is 31. Very important piece of information, right? Patient was prescribed apixaban and atenolol. Write down the prescription for the above medication. All right, we haven't been provided any dosage of any medication, so let's jump right into the PNF and search for the doses of these drugs, right? So the first one we are going to look for is apixaban, right? Prophylaxis of venous thromboembolism following knee replacement. No, our patient is not having this. Prophylaxis of venous thromboembolism. No. Here it goes: prophylaxis of stroke, systemic embolism in non-valvular atrial fibrillation. This is the condition which our patient is having, and the dosage is 5 mg twice daily, 5 mg BD, right? But it says the story doesn't end here. It says 2.5 reduced dose if the patient's age is 80 years. Our patient's age is 81, right? Our patient's age is 81. The patient is 81 years old. So our patient is fulfilling one criteria. What is the next criteria? If the patient has a body weight less than 61 kg, our patient's body weight is not mentioned, so we don't need to consider this one. Similarly, if the patient's serum cret is above 133, our cret hasn't also been provided, so we don't need to reduce the dose. As I mentioned before, that we were told about the renal impairment of the patient. The renal clearance was 31. So it says here that use with caution if creatinine clearance is 15 to 29. Our patient's creatinine clearance is 31, so we don't need to worry about this. Again, the criteria which I just showed you guys, up above 133 microliters, we haven't been provided this information. Weight less than 61 kg, we haven't been provided this information as well. So our patient is fulfilling one of the three criteria, that our patient's age is above 80 years, so we don't need to reduce the dose, right? So it is safe for us to prescribe 5 mg twice daily to our patient of apixaban. You are going to write it in the regular medication portion: apixaban tablet per oral 5 mg twice daily, right? You guys can write it there, right? So next thing is atenolol. Right? Let's look for the dose of atenolol. Our patient was having non-valvular atrial fibrillation, which is a type of arrhythmia. So the dose for our patient is going to be 50 to 100 mg per daily. 50 to 100 mg. But what should we give, 50 or 100? look it up in the renal impairment, because we were mentioned, it was told to us that the renal the creatinine clearance of our patient is 31 ml, right? So our patient is fulfilling this criteria. The patient is having a renal clearance of in between 15 to 35, so it says that use maximum 50 mg daily if EGFR is between 15 to 35. So we won't be able to prescribe our patient 100 mg OD. We will be prescribing or adjusting the dose according to the renal impairment, and we will be prescribing them 50 mg OD, right, by mouth. So that is going to be the dose for atenolol. You are going to fill this detail in the regular prescription section, right? So atenolol, it says 50 to 100 mg per day. Here's the key. It says max 50 mg if the EGFR is between 15, the same thing, right? So you can we'll be giving 50 mg to our patient OD. Apixaban, we will be giving 5 mg twice daily, but if the patient is fulfilling two of the following criteria, we are going to reduce the dose. But our patient is not fulfilling our patient is just fulfilling one criteria, so we don't need to reduce the dose or adjust the dose, right? All right, so let's move on to the next section. We have MRSA. Mr. David Halifax, aged 82, has been diagnosed with MRSA infection. Patient was on the following medication: amlodipine, paracetamol, PRN as required, mepirocin, vancomycin. Weight is 80 kg. EGFR is normal. Consultant has decided to give dash. You would be provided this information, but we haven't been given here in this particular station. But don't worry, you guys will be provided as to how much fluid you have to give. Write down the prescription for the above medication, check dose, and write down vancomycin. Right. So we have been provided dose for amlodipine. Okay, we are going to fill in this detail first. Obviously, after filling in all of the patient details, we have been provided dose for paracetamol. Okay, paracetamol PRN as required, max 4 grams. We are going to give 1 gram SOS, right, or PRN as required. SOS and PRN are same thing, which means that as required. Mepirocin ointment BD 5 days. Similarly, we have been provided the dosage for this one as well. We are going to write it. You guys are going to write mepirocin in the antibiotic section, right? Next thing is vancomycin. Very, very important. We have to look for the dose of vancomycin. So when I'll just show you guys how you're going to look for the dose of vancomycin, right? Whenever we are prescribing vancomycin, there are three very, very important things which we have to look for. Number one is the dose of vancomycin, as to how much vancomycin you have to give, right? Second thing is this drug is always diluted in fluid. It is always diluted either in normal dextrose solution or normal saline, and we have to find second thing we have to look for is to how much fluid we are going to dilute this drug in, right? And then third thing is we have to prescribe it over a period of time. We can't give vancomycin in rush. We have to prescribe it over a certain period of time. So the third thing is we are going to look for is that over how much time period should we dispense this drug or administer this drug to the patient. Let us look for this information in the BNF, right? So here we go. Our patient was having MRSA infection, right? So here comes vancomycin, a picture of BNF. Is our patient having Clostridial difficile? No. Alright, moderate diabetic foot, no. Cellulitis, no. So our patient is having type of skin infection, complicated skin, soft tissue infection, bone infection, joint. It is obviously MRSA infection is going to fall under this category because it is a type of skin infection, right? So perioperative prophylaxis, that is not what our patient is having. Surgical prophylaxis, no, right? Peritonitis, no. So most likely our patient is falling under this category. So we are going to give our patient, the dose is going to be 15 to 20 mg per kg, 8 to 12 hours apart, right? So the weight of our patient was 80 kg. So the dose is going to be 80 into 20, 1600 mg, or if we multiply it by 15 into 80, it comes to 1200. 1200. You can either give 1200 or you can either give 1600. All drugs, they have a fixed range which is safe to be given, so whatever is easier for you to calculate, you can give that drug to the patient, that dose to the patient. So the renal impairment for our patient was normal. We don't need to worry about the renal impairment. So far we have been able to find the dose which we are going to give. Next thing we have to look for is how much fluid we are going to give, right? For intravenous, so here it comes, direction for administration. This is the next page, don't worry about this thing. This was I think page number 565, and this is page number 566, right? So it says with intravenous use, avoid rapid infusion. As I just mentioned before, that we have to give it over a certain period of time. So for intravenous infusion, give intermittently with glucose 5%, sodium chloride. Reconstitute each 500 mg with 10 ml of water for injection and dilute with infusion fluid to a concentration of up to 5 mg per ml, right? So it is plain simple mathematics. If the dose which we are going to give is 1200 mg, right, and we want it to be 5 mg per ml, or so how much fluid do we need to give, right? It is plain simple mathematics. 1200 mg is the dose that we are giving, and we want it to be 5 mg per ml. How many ml of fluids should be given, right? So plain simple mathematics, dividing 1200 by 5, it comes to 240 ml of fluid, 240 ml of normal saline or dextrose solution, 5% solution, right? So this is plain simple mathematics, just like that. If John has 1 pound and he can buy 10 pencils with 1 pound, how many pencils can John buy if he has 5 pounds, right? So that is plain simple mathematics which we all used to do in 5th grade. So similarly here, if the dose of a drug is 1200 mg and we can the dilution has to be 5 mg per ml, how many ml do we need to have? Simply dividing 1200 by 5, it comes to 240 ml. Plain simple mathematics, right? Next thing is that we have to calculate the time over which, so we are up until here we have found 2 things. Number 1, the dose which we are going to give. Number 2, the fluid which will be giving, right? So third thing which we have to find out is over how much time period should we be giving, right? It says rate not to exceed 10 mg per minute, right? So if we have 1200 mg, right, and we can't give more than 10 mg per minute, how many minutes is going to be? 120, right? So simply plain simple mathematics, if in 1 minute 10 mg can be given, 1200 mg are going to be given in how many minutes? It is going to be 120 minutes, which is going to be 2 hours. Obviously all of us know that 1 hour is equal to 60 minutes, so 2 hours are going to be equal 2 hours are going to be equal to 120 minutes. So yeah, the way you're going to fill in this information, you're going to go to the and you can either write it in the antibiotic section as well, and you can write it either in the IV drug section as well. In antibiotic section you can write drug vancomycin, route intravenous, and then in additional information section write give with 240 ml of normal saline at the rate of since we are giving 240 ml over 2 hours, the rate is obviously going to be 120 ml per hour. Simply dividing it by 2, the rate is going to be 120 ml per hour. So we can write give vancomycin 1200 mg along with 240 ml of normal saline at the rate of 120 ml per hour. So we can write it like this, or we can write it in the IV drug section. The way we are going to write it is give 240 ml of normal saline. The additional drug we are going to add is vancomycin, and the rate of infusion is going to be 120 ml per hour. This is a little bit difficult to grasp you this information. All of this I can understand. You guys will have to practice it a few times before you are able to hold a grasp of it. I know I haven't included the IV infusion or IV drug section page here, but you can Google it up and you guys would be easily be able to find the IV infusion page, right? So I hope the vancomycin thing is clear to you guys. Don't worry about it. Solve this station again and again. Practice it all by yourself. Only then you would get